The first witness to give evidence today is Joanne Williams, who previously gave evidence in an agreed evidence statement for the case of Child A and Child B. The court is reminded she was a neonatal nurse in June 2015. Miss Williams recalls she was the designated nurse for Child C on June the 13th and had cared for him prior to that day. She said that particular day shift was not too busy. She recalls Child C was small and premature and weighed 800 grams at birth. A nursing note made by Miss Williams is presented to the court, written retrospectively at 4:19 p.m. on June the 13th, showing Child C was on NCPAP with 23 to 26% oxygen, quote, a minimal amount of oxygen. Miss Williams said that was a good sign. A blood gas reading was very good at 9 a.m, but Child C was noted to be very unsettled and fractious, which Miss Williams tells the court was not that uncommon for a baby of his size. The note adds Child C was allowed to be taken off CPAP to have skin-to-skin contact with mum. Miss Williams says such contact is extremely powerful for a newborn baby and is really beneficial for them. The note adds Child C, quote, calmed down straight away while on mummy, just required some facial oxygen while out. No signs of increased work of breathing. Child C was weaned off CPAP for 2 hours and placed on Optiflow at 1 p.m, as it was noted the baby was so unsettled on NCPAP. The court hears Optiflow is a less invasive form of breathing support than CPAP. Child C was, quote, very settled this afternoon, with a slight increase in respiratory rate. A further blood gas reading was taken later in the afternoon, with readings, quote, not quite as good. Miss Williams said this was something to take into consideration and had followed Child C being placed on Optiflow. The note adds, quote, clinically remain stable but aware do not want to push Child C. Miss Williams said fluids were increased with 10% dextrose discontinued as it was day 4 and the dextrose would not have been needed with lipid fats increased to support nutrition. The note adds, quote, continues to have dark bile aspirates frequently this morning. Miss Williams says it's not reassuring as it could be a sign of NEC, a gastrointestinal disease. Philip Asprey, prosecuting, says, was it of concern? Miss Williams replies, yes. It was escalated to an on-duty doctor that day. Miss Williams says Child C was on nil by mouth and a cautious feeding regime. The court hears Child C had pulled out 2 oral gastric tubes during the morning due to being, quote, feisty and unsettled. A nasogastric tube was on free drainage to drain air from Child C, reducing air build-up in the stomach and to check for any aspirates. The note adds, quote, abdomen full but soft. The court hears that was quite normal for a baby, for Child C. The abdomen had a slight shine but not veiny or distended. The court hears a distended abdomen would be a symptom of NEC. The note adds, quote, if aspirates improve, can start tropic feeds this evening. Rantadine was administered via an IV to counteract the bile aspirates. The weight of 717 grams was noted, which Miss Williams says is not unusual as all babies lose weight in the first few days. She said doctors were aware of the weight update. A cranial ultrascan was carried out with no abnormalities detected. An intensive care unit chart for Child C is now presented to the court, which details the various readings and notes corresponding to Miss Williams' nursing note. The aspirates of dark bile are recorded at 9 a.m. and 1 p.m. 0.5 ml dark bile is recorded at the latter, which was a small amount, but any dark bile was a concern, Miss Williams says. A further 0.5 ml of dark bile is aspirated at 4 p.m. A nursing note of family communications from June 13th is shown to the court, written by Miss Williams. She records, quote, mummy and daddy on the unit during the day. Both have had skin-to-skin contact with Child C. Pleased to see him more settled this afternoon. Appear happy with plan of care. A further nursing note showed a blood gas reading at 6 p.m. was, quote, improvement from previous CBG, but lactate levels had increased. Child C remained on Optiflow and was stable. The aspirates were reduced this evening. The note adds, quote, question mark, commence enteral feed tonight. Miss Williams clarifies that means query. Miss Williams said you would always be cautious of a baby that size, referring to child C. Mr. Astbury, on behalf of the prosecution, says, "How was the progress during that shift?" Miss Williams replies, "He had done well. Weaned off to Optiflow, he had benefited from time with mum and dad." Ben Myers, KC, for Letby's defence, is now asking Miss Williams questions. She agrees that you can never be complacent with a child like child C, and however stable he is, he would require close monitoring. She said it was important to carry out observations and look for subtle signs. Mr. Myers says the observations for child C need to be taken into context for a baby of the size of child C. Miss Williams says that could potentially be the case. She adds she was aware of pre-existing concerns raised at child C's birth. Mr. Myers asks if child C still needed breathing support with Optiflow and would not have been switched if he had been settled on NCPAP. Miss Williams says he had good blood gases, so was able to step down respiratory support to Optiflow. Mr. Myers says, "You are documenting all the little changes made on the nursing notes because he is such a little baby, is that right?" Miss Williams replies, "It is important to be thorough." The note of, quote, "aware do not want to push child C" is raised. Miss Williams states, "It's making sure we are doing individual care and very aware of what's happening with child C and what he needs. Not wanting to push child C was not to tie him and or administer procedures such as a lumbar puncture." Miss Williams said not wanting to push child C in this context was in relation to breathing. Mr. Myers said, "Could that apply to feeding as well?" Miss Williams replied, "Yes." The matter of dark bile aspirates is mentioned. Mr. Myers says, "We have seen from the chart that aspirates have been taken throughout the day, and they have been there the day before?" Miss Williams replies, "Yes." A distended abdomen could be a symptom of other conditions, Miss Williams adds, but NEC would be one which would be of concern. The tropic feeds, as mentioned on the nursing note, would be via expressed breast milk if the aspirates improved, along with the overall clinical picture, Miss Williams tells the court. The weight of 717 grams is a significant reduction, isn't it? Mr. Myers asks. Miss Williams says it would need to be taken into context and it was important to administer the feed safely. The plan to do so would be, following a discussion, to commence enteral feeds that night. Mr. Astbury, on behalf of the prosecution, rises to ask one more question on CPAP. Quote, "Would you ever take a baby off CPAP just if they were unsettled?" Miss Williams replies, "No." The court hears the step down to Optiflow would be done in consideration with other factors. Miss Williams has now finished giving evidence for child C. The next witness to give evidence in court is Sophie Ellis, who was working as a neonatal unit nurse in June 2015. She recalls child C and first saw him when he was delivered as an observer learning in the nursing role. She said she was on duty for the night shift of June 13th, starting at 7:30 am, ending at 8 am the following day. She said she was allocated to look after child C for that shift on her own, with support from another staff member as she was junior in her role. The nursing staff roles for that shift are presented to the court, with Miss Ellis, the designated nurse for child C, and Lucy Letby looking after two other babies in a neonatal unit. She said she was aware child C had been moved to Optiflow and knew the subject of feeds was a topic being discussed. Hopefully they were going to start feeds. Her nursing note is shown to the court, showing care taken over at 8 p.m. Quote, "Safety checks completed and fluid requirements calculated. Optiflow in 25% oxygen, observations satisfactory, respiratory rate elevated at times as previously been for past few days. Pink and well perfused, active and alert. The fluid dose is stated due to birth weight of below 1,000 grams. The long line sight was satisfactory. A blood gas reading was taken at 2 am. Trophic feeds were agreed to be started." Miss Ellis said she was not present for the first desaturation as she had left the room. A discussion on trophic feeds was had before 11 p.m, with the feed administered at 11 p.m. Miss Ellis said, quote, "There was nothing particularly striking about the care for child C between 8 and 11 p.m. He was doing well and was feisty at that time." A retrospective note written by Miss Ellis says, had 2 fleeting bradycardias, self-correcting, not needing any intervention, shortly before prolonged bradycardia and apnea requiring resuscitation. She said she had left the room, quote, just around the corner, then the alarm went off. She said she could not recall which type of alarm it was, a lower level yellow or a more frequent urgent red alarm. She said she went into the nursery, having been out, quote, for not a long time. She recalls upon entering, quote, I saw Lucy standing at child C's incubator. She said he had just had a brady and a desaturation. I can't remember what she was doing at the time. After that, the brady and the desat resolved quite quickly. Miss Ellis said she didn't do or see anything being done to correct the desat and bradycardia as child C self-corrected. She added she then sat at a computer which faced a wall, with child C behind out of view. She explains Lucy Letby was still in there, but not sure about anybody else. Child C, Miss Ellis tells the court, had a further brady and desaturation, which did not resolve and required resuscitation. She said when she turned around, Lucy Letby was stood at the incubator. A nursing colleague had asked her to put out a crash call. Prior to administering the 11 p.m. feed, Miss Ellis said she had aspirated a tiny amount of light green bile from child C. A nursing colleague who was in the room said to put out a crash call, and Miss Ellis left the room, she tells the court. She said she left the room not for long. She said when she returned, a nursing colleague was getting ready to administer drugs and for her to continue chest compressions. She said Lucy Letby was at the side of the incubator but cannot recall what she was doing. Miss Ellis said the medical team of registrars arrived along with a doctor to the unit at some point. Miss Ellis adds the parents were then informed. She said she became upset herself as this was, quote, the first time something like this had happened in her experience and she found it overwhelming. Lucy Letby said to her, quote, do you want me to take over? To which she said, yes. Miss Ellis said she then left the room, taking a minute to compose herself before returning to the unit to look after other babies. The nursing note says care for child C was handed over to senior nurse Melanie Taylor following the collapse. Miss Ellis reiterates that, from memory, there was nothing that concerned her about child C's condition between 8 and 11 p.m. Mr. Myers, for the defence, asks how long Miss Ellis had been working at the Countess. She replied it was since January 2015. Miss Ellis said she had not previously cared for a baby as small as child C. Mr. Myers asks, how is it that someone as inexperienced as you was given the responsibility of looking after child C? She replies, child C was very stable and I was being supported by Melanie Taylor. You were very well supported at the Countess of Chester Hospital. Miss Ellis said, quote, there was always a nurse in the room looking after child C, even when she left the room briefly. She said Lucy Letby was in there and cannot recall if Melanie Taylor was also there. Miss Ellis says child C could have had 2 braddies as they are quite common. She said she did not know whether Melanie Taylor was in the room at the time of the collapse. Miss Ellis tells the court for one of the 2 braddies, Lucy Letby was in the room. That was for the second one, but not the first. Mr. Myers refers to the 8:46 a.m. June 14th nursing note and said there was nothing prior to the 11:15 p.m. collapse. He asks why the first braddies are not mentioned. Miss Ellis replies, I would have forgotten to write it. It was a traumatic shift. Miss Ellis says she would have added the detail of that on her subsequent nursing note. She says she does not remember if Melanie Taylor was in the room at the start of the collapse. Mr. Myers, for the defence, puts it to Miss Ellis that Lucy Letby was not in there at the time of the collapse and only arrived later during the resuscitation efforts. Miss Ellis replied, I don't agree with that. Mr. Myers states, you have placed her there when you spoke to the police several years later. Miss Ellis replied, I don't agree with that. Miss Ellis has now finished giving evidence for child C. The next witness to give evidence in the case of child C is Melanie Taylor, who has previously given evidence for child A and child B. The court is shown Melanie Taylor's observation chart for child C on the night shift from June 12th to 13th, where normal readings are made for the heart and respiration rate. 2 of the readings were slightly elevated, but were normal given the context child C was on CPAP at the time. Temperature readings were stable and in normal limits, what you would expect. Other readings were considered to be normal. The handover note for the June 13th night shift is presented to the court, showing Melanie Taylor is one of the nurses on duty that night and a designated nurse for one of the babies, not Child C. She confirmed she was present in room 1 that night, in the same room as colleague Sophie Ellis. She said, quote, "Sophie was a very competent nurse. She was completely able to look after Child C. I had no concerns with her. He had been stable. I was there for support if she needed it." Miss Taylor said her memory of the collapse was that she did not know where she was at the time Child C deteriorated, but when she arrived at the incubator, Lucy Letby was already there. She did not know if anybody else was in the room at that point. She recalls, quote, "I think also Sophie was there, as she was caring for him. Ventilation support was provided via a neopuff device, and Miss Taylor struggled to get any chest movement for Child C." Miss Taylor said Lucy Letby suggested using a type of ventilation support, a Gedel device, to aid Child C. The Gedel device was followed by the use of the neopuff. Miss Taylor said a crash call was put out. She added from her statement, chest compressions began before the first doctors arrived in the unit. The on-call registrar was first to arrive, Miss Taylor said. Miss Taylor recalled the chest compressions and resuscitation attempts went on for some time. Child C later died. The time of death recorded as 5:58 a.m. on June 14th. A retrospective nursing note by Miss Taylor, written a couple of hours later, said, quote, "Call to help as baby had brady-DSAT. When arrived to baby apneic." Mr. Myers, on behalf of the defence, is now asking Miss Taylor questions about dark bile aspirates. He said Child C was a stable baby, with the aspirates not being a major cause for concern. Miss Taylor said, quote, "It's not something we would initially be very worried about, but would take into consideration and act very cautiously when we find bile. I was not necessarily concerned he was unstable." Miss Taylor continues, "You have to look at the bigger picture and see what it could possibly be and see if it could be NEC and act on that, and take it as a consideration. We do encounter bile in premature babies. We would have to act appropriately, and if there are no other signs of NEC, then we would treat accordingly." Mr. Myers asks if there could be other, more immediate problems associated with dark bile. Miss Taylor said that would be a matter for doctors to examine if there was a possibility of that. There is no room for error with a baby like Child C, is there? Miss Taylor agrees, and agrees there are inherent risks with treating such a baby. Mr. Myers asks about the experience of colleague Sophie Ellis. Miss Taylor responds, "You do have a foundation training in neonatal care and you would look after a baby on CPAP. New nurses have to get experience and I was supervising and she was very competent. She would not have been left alone." Mr. Myers says, "It was a very busy shift, wasn't it?" Miss Taylor replies, "Yes." Mr. Myers says Miss Taylor was not sure she was in the room when the collapse happened. "The only person you remember being there was Lucy." Miss Taylor agrees. She adds she assumed Sophie Ellis was also present. Mr. Myers says, "It is from your account Lucy is there. No one else is present. Maybe Sophie?" Miss Taylor replies, "Yes." Mr. Myers says, "I'm going to suggest you were in the nursery when this happened." Miss Taylor says she doesn't believe so. Mr. Myers says, "That it was Sophie Ellis who called you?" Miss Taylor replies, "It might have been." Mr. Myers says that Lucy Letby was not there at the start of this. Miss Taylor replies, "I disagree." Mr. Myers says Miss Taylor in her police statement said she was, quote, "pretty sure she was already in nursery room 1 feeding another baby at the time of the collapse." Miss Taylor says her memory has deteriorated since then, and what is in her police statement is correct. Mr. Myers says Miss Taylor's police statement said she was called over by Sophie Ellis and there is no mention of Lucy Letby. Miss Taylor said, "No, but she was there." Miss Taylor said she read her police statement for the first time this morning and had not memorised everything from it. She added, quote, "I didn't say Lucy Letby called me over. I likely wasn't asked by police if Lucy Letby was there. Now I've been shown that statement, I can remember Sophie called me over. Years have passed since this happened." Miss Taylor said she has not changed her mind about who was present there. "I tell you now, when I approached the incubator, she, Lucy Letby, was there on the other side. She added she remembered how cool and calm Lucy Letby looked at the time. Miss Taylor said she hadn't said Lucy Letby was not in room 1 at the time of the collapse. Miss Taylor tells the court she didn't think it was necessary at the time to include that information of Letby's presence to police. Okay, so that concludes day 15 of the trial concerning Lucy Letby. If you wish to keep up to date with all the comings and goings from the court process, please don't forget to give this video a thumbs up and subscribe down below. You'll also see the Lucy Letby playlist, which has all of the videos that I've done concerning this case thus far, so do feel free to check those out. Many thanks for joining me for this video. I look forward to seeing you all again for the next one. Take care. Cheers.